So our guest today is Marisa Alexis. So Marisa, she's an infection prevention and control consultant and health profession specialist with over 20 years of healthcare experience, including 17 years in infection and prevention and control. She is known for advancing infection IPS for short, IPS strategy, health protection, and due to innovation, achieving measurable improvements in patient safety and regulatory compliance across complex systems. Marisa has held senior roles within the NHS, ambulance services, integrated care boards, and public health, successfully leading major IPS programs to reduce infection risk and building organizational resilience. She holds a master's degree in disease prevention and control, and she's currently completing a doctorate in health science. Alongside consultancy, Marisa coaches and educates health professionals in artificial intelligence, supporting safe and ethical digital clinical practice. Ladies and gentlemen, I present to you Marisa. Hi, Marisa. You can unmute yourself.
Hi, thank you for having me. It's a
Thank you.
pleasure. Feel very privileged to have been asked to come onto your podcast today.
Oh no, it's good to have you. Now, Marisa, let's start from the very beginning. Yeah, let me just ask you, what was your career journey like? How did you get here? I'm sure it's not something that happened overnight. I just wanted to walk us through that journey. How did you get here?
Yeah, so
Very
as you,
briefly, if possible.
I'll try to make it brief. So as you said, I have been in professional practice for over 20 years. I wouldn't rattle off all of the things that you just said, but immediately post-qualifying, I became a community nurse, but within a year, I realized this wasn't for me. I then moved into theatres. I stayed there for about 5 years, and I had a placement in maternity theatres where I had a senior role. And I kept recognizing that there were areas that we could improve, not only the care we provided, but also how we as the staff work, so we could improve both staff and patient experience. But I didn't have a voice. My recommendations weren't being taken on, so it frustrated me, and that led me to pursue my undergraduate degree in public health. I just decided, you know what, I'm going to do a degree in public health. I don't know where it'll take me, but I just started, paid out of my own pocket, and started doing this BSc because I really knew that I wanted to be in a place where I could influence policy and practice. So a few months after starting my degree, my trust advertised for a band 6 IPC nurse. It wasn't a promotion for me, it was a move across, and a move across with the less money because I'm now coming out of unsociable hours into 9 to 5 practice, which was a really big sacrifice for me at the time. But I've always had good foresight, and I just knew that, this would take me somewhere. So I made that sacrifice. I moved into IPC. Since then, I've held senior leadership roles across the breadth of the health system. So I've worked in every area of the health system you could think of. I've done mental health, I've done ambulance services, I've done integrated care boards, I worked for NHS England, and I've done quite a bit of public health. So, and over the past 7 years, I've been doing that as an independent contractor. So I work for the NHS, but for my private business to the NHS, if that makes sense. And what that has really done for me is given me a lot of flexibility. One notable experience I had during the pandemic, I was headhunted to work for Warner Brothers Studios. So during the pandemic, I started my own little business. I was asked to do some work for Warner Brothers Studios, and this is because I don't know if you remember, during the pandemic, there were very few industries during lockdown that had permission to keep working, and the film industry was one of them. And, that was an amazing opportunity. I met Jude Law. I still have his number on my phone, actually. I met Eddie Redmayne. I met Johnny Depp. So that was a really good experience that I never thought my career pathway would have taken me to. Um, Over the past few years, my career really has been centered around transformation and improving quality and population health. And I joke that I've been stuck in a textbook for the past 15 years because I'm continuously improving my knowledge base. If I'm not doing a leadership course, I'm doing project management, I'm doing something on AI, I'm always improving my knowledge base. And my doctorate degree is the latest thing which, has consumed me for the past 6 years, but not hopefully, it will be done before Christmas. That will be the end of it. I first became interested in that intersection between IPC and AI a few years ago. Well, on AI on a whole, a few years ago when I was working with a local authority. I was leading their health protection service. And I was afraid of AI. I'll be honest with you, like a lot of people, I thought it was, this is the beginning of the end of the world where machines are going to take over. And if any of you are from my age group, you would know about those Terminator movies where it was man against the machine. And I just saw so many similarities with that movie, and I was thinking, gosh, this is what AI is about. So I stayed away from it. I was afraid of it until one day I was in a meeting and one of the consultants started talking about how he used AI to book his cycle journey from one end of the country to the next. And he was able to use it to find out which pubs to stop at which time. He used it to map when to get to the coast for the low tide. And it was so intricate how this AI tool was able to, down to the last detail, map this journey. And I thought, oh my gosh, this is amazing. And from then, I just went down the AI rabbit hole. I started doing my own research and I started looking into it. And the more I looked into it, I thought, oh my gosh, this thing is amazing. I was blown away by the capabilities of artificial intelligence. And from me talking about it endlessly in meetings at work, my director at the time asked me, Marisa, you seem to know a lot about this. Can you do some training for the staff? So that's how I started doing AI training. So it really started in public health.
Fantastic. I've got my pen with me, and as I'm writing down as I talk and as you talk, and I'm amazed, honestly. One of the things you said that stood out to me, you said something about that you have foresight because you're somebody with foresight because you there was you had to sacrifice your unsociable hours, which that's a big thing for us as nurses because you saw the opportunity in infection in IPC and you thought, okay, I'm going to sacrifice this and I'm going to make this move. And then I think it's a good part for me. I'm going to go with it. Well, what would you say to a nurse who is in that space right now thinking, oh, if I'm going to make this jump, whether into anything, whether into AI or change of career, I would be sacrificing this bit and I'm not ready to do that yet. What will you say to that person in that position?
There will never be a right time.
Mm.
There will never be a right time. You will always be able to come up with an excuse of why I can't do it now. I've got this going on. I can't do it this year. I got that going on. I can't do it next year. Do you know if I tell you what my life was at that time? My salary went down more than £1,000 a month by taking that step. But I don't regret it because when the pandemic came around, people like me were gold dust. I had contracts coming out of my ears. I was doing NHS England in the day. Then I would be on call for public health from 5 to 11 doing twilight. On the weekend, they would be calling me to do on calls. And had I not taken that jump, those opportunities would never come to me. I would never have gotten to Warner Brothers Studios and make that kind of money that I was able to make from those opportunities. So if you want to do it, if you want to jump into any specialist area, the first thing I would say is do your research. One of the things I have always done throughout of my career is NHS jobs. I am forever on NHS jobs, not necessarily looking for jobs, but I want to see what is out there. What is there? What are they advertising a lot of?
Yeah.
Right now, I could tell you what they're advertising a lot of is transformation this, digital that. So
Yeah.
that tells me this is the way things are going. Another thing that would help with foresight is the government documents that they bring out. The NHS long-term plan talks a lot about the digital move. It talks a lot about AI in it. So what does that tell you? That's the way we're going. So if you want to move out of that clinical practice and come into a place of influence, come into a place that is potentially quite lucrative, you need to make the move, but get the information, see where things are going, and then decide which way you want to go. Quality is
Yeah.
another area that will never, it will never die. And another thing I would say, another reason why quality is another potential direction one could go in is because our NHS is moving towards a private system. It may not happen tomorrow, it may not happen in 10 years, but the wheels have been put in place. So if you look at how the ICB, let's not even talk about the ICB yet. Let's talk about before the ICB, where we were PCTs, then we were STPs, then we were clinical care groups, then we became integrated care systems. Now they're scrapping that for another model. If you look at how those systems were set up, you would understand that we're moving towards that model of how private healthcare is delivered. So if you think about all of that, where would you best be situated? There would be a need for accountability. There would be a need for quality. There would be need for measuring outcomes. So I could go on. That's a whole other day,
No,
but I could really
that's
go on about that. So if you're thinking about making the move, don't wait because there'll never be a good time.
absolutely. Thank you. So the summary is take the jump. There won't be a perfect time for anything.
Never.
Fantastic. Now let's bring it down to the main bit of why we are gathering here. It's about AI and how you've applied it in your role as somebody with huge experience in IPC. Tell us how that started and what you're doing now.
Okay, so when we think about, AI and IPC, we are, as a specialism, we are woefully behind the curve. So I think healthcare on a whole is behind the curve of other industries who have really harnessed AI technologies to create efficiencies and to improve and enhance the way they work. We are woefully behind, but in IPC, we are even more behind the curve. And there are so many areas of our practice where we can use AI. I introduce AI in my IPC practice. So the services that I lead and that I have been head of in the past couple of years or so, I have been utilizing it for the likes of data analysis. So the data analysis roles where you would have needed a data analysis to do some modeling or modeling for you in the past, and it'll take them 2 weeks. With AI, 1-2 days, you're done that job.
Yeah.
So I have been using it for that. So cutting out that need of using data analysis. I've also been using it for predictive analytics for prevention.
Mm.
It's enhanced surveillance. Quality improvement is another area. And there's so many more areas. But because IPC is behind the curve, I am only able to do this now within the areas that I lead. I am working with my industry leads to bring them on board to sell the message that we need to get behind this now. So like the likes of the Infection Prevention Society and the Healthcare Infection Society, there's still apprehension with those two bodies who are our
Mm-hmm.
industry leads with
Mm.
utilizing AI.
Mm.
But
Mm.
certainly within my practice and everywhere that I've been working, we have gone full steam ahead and utilizing it in our IPC practice. So all my work is really a bit pioneering.
Right, right, right. Fantastic. I think it's brilliant what you're doing. Um, I'm gonna go back to this bit in a minute, but a question just popped into my mind. So you said something about you introducing it in IPC, and did you need to have a degree in artificial intelligence, or did you have to do a massive course? Because I say this to say, because that's the first question people ask me, that what course did you do? And I'm like, oh yeah, that's interesting. So I'm asking you as somebody who is in it, yeah, who is in you understand it in and out. Did you have to do any course on AI to lead this pioneering thing that you're doing?
I believe the structured education is important.
Yeah.
I believe that having that knowledge base is quite important because what you learn from AI, what you learn about AI from Google is maybe a tenth of what AI is and what it can do. So you
Mm.
need proper understanding of LLMs, of machine
Mm.
learning to understand
Mm.
how to utilize it. So
Mm.
if this is a space that you want to be a thought leader in, I would recommend that you do a proper course. I would probably say you should start with an introductory course, an introductory to AI, what it is, like Coursera do those free courses,
Mhm.
an introductory to AI. If you really want to move into that space and position yourself in your trust as an AI leader, I would then say you probably should do a course that's focused on AI in healthcare so
Mhm.
that you
Mhm.
have understanding of how to use it across the breadth of clinical practice and you'd be able to understand the language. As you know, the language is quite important. Me saying LLMs to the regular person on the street, they wouldn't have a clue what I'm talking about.
Yeah. Yeah.
Yeah. So if you want to move into that space, I would say yes, do a proper course. But if you want to utilize it to create efficiencies in your clinical practice as a leader, I don't think you need to do any
Okay.
big course. I think you probably, yes, maybe do some of what the free stuff that Coursera offers. But I would also recommend that one of the key things I would say you should learn is prompting, how to speak to the models, because the way you speak to it would determine the value of the result you get. So if you need so prompting is the way you ask it questions. How you ask it questions is really important, as you would know. So I would recommend doing, and you could do these online. This is one of the courses I offer as well, a prompting masterclass, just how to create prompts, how to structure your questions to the model, to the tool so that it would give you the best outcome.
Brilliant. So let me just to understand the answer you provided. You've said two things. The first one is if you want to be in a place where you want to lead in AI in your workplace, yeah,
Mhm.
your clinical background is the most important thing. Then, if you want to go further, yeah, you want to go further and go deeper and understand it, then you can, it's okay to do a course. But your clinical strength and your experience, it's what is valuable. And then combining that with what you learn on Coursera and anything, place you in a better place. Did I hear that correctly?
Yes, I think that having a certificate gives you credibility.
Okay.
Yeah. And another thing I forgot to mention is understanding data literacy. So
Mm.
and you don't need to do a course for that, but from your other undergraduate study you would have done, you would have had some understanding of how data is collected, how it's structured, especially within healthcare. So having that data literacy is important. And then maybe move on to that understand introduction to AI concepts, how to
Mm.
prompt. And if you want to utilize it in the workplace, your program should include some data ethics.
Okay. Yep. Yep. Because that would, what you said now just led me to the question I have in mind, that I'm curious to know what kind of LLM. For those who don't know, LLM is large language model, and your ChatGPT, your Microsoft Copilot, your and so on. They're examples of LLM. I'm curious to know, which LLM are you using in your trust at the moment, and how have you managed the ethics around it? Because you're using data, how have you been able to cover that bit just to make sure that that safety element is, it's sorted out?
Okay, so quite a few trusts now and local authorities are developing their own AI policies. So
Okay.
have a look, see if your trust has an AI policy,
Yeah,
ask that
policy.
then.
Yeah.
Now, the main reason why these policies are being developed is because of the confidentiality and the data sharing element, because the way ChatGPT and other models work is you input information
Mm-hmm.
and it gets stored in this big database in the sky, and people draw from it as they need it. So information you put in could be seen by other people. So
Mm.
there is that confidentiality element of it. But there are ways to work around that. And this is where understanding how to prompt is important, because if you understand how to prompt and ask the right question structured in the right way, you shouldn't need to input any sensitive information
Okay.
that your trust would have a problem with. So you
Okay.
could still get the results without identifying yourself or identifying your service or identifying your patients.
Hmm. Right. So your IP,
Oh,
your,
yeah, sorry, I forgot the second part of your question.
yeah,
So
I want, yeah,
yeah,
yeah.
so within my service, we're doing two things. So one of the things we are doing is actually building our own AI system.
Oh, brilliant.
And it's around how we manage IPC queries. I can't speak too much about it because it's still in developmental stage and there's
Yeah.
some confidentiality there. So we're building our own where we are giving it all the information it needs so that staff throughout the trust could tap into it to get the answers they need.
Mm.
So that's one aspect of what we're doing. But on a day-to-day basis, one of the things that we are also doing is we are not Copilot. I know you just mentioned Copilot, but Copilot isn't great. It just
Right. If you
isn't
say it,
great.
I believe it.
It just isn't great. It just isn't the best thing you could use. And I think maybe because it's free, it's it's not the best thing you could use. So one of the things that we are also doing is using it for modeling. So I give
Okay.
you an example of how we have used it recently within one of the services I lead is we had an issue with emergency vehicles. So it's an ambulance service, and our emergency vehicles they weren't on a deep clean cycle. So unless a vehicle was involved in a high consequence infectious disease incident, it wouldn't have a deep clean. So potentially vehicles could be on the road where people are being picked up in these ambulances that have been on the road for 2 years and never had a deep clean. So think of it as a side room in the hospital, never being deep cleaned. Think of it that way. It never having a decant, it never having a deep clean. So this obviously created a risk to the organization, which we put on the corporate risk register because it increased the transmission of infection between both staff and patients. And I was more concerned about staff because patients might be in the ambulance for 45 minutes, but staff are there. They have a common denominator. So it became a corporate risk, and I was tasked with leading on developing this decontamination program for the vehicles. And to implement such a program, it's very complex. It required input from a variety of stakeholders, from operations to fleet to estates to IPC, finance, which was very important. So we used AI to help arrange and help with the analysis from the gap and help with the gap analysis. So we use AI to develop the gap analysis.
Right.
Then we used it to analyze the data.
Okay.
We then used it to use that data to develop a cost-benefit analysis of if we don't do this, how much it'll cost. If we do this, how much it would save. And where it was most valuable was with the mathematical modeling that was required to determine the amount of resource we needed and in which areas to focus that resource. Because what we couldn't do is to reduce the service to have vehicles deep clean. We still needed the same amount of vehicles on the road, but we also needed several out of service at a time to be able to have them deep clean. And we use AI to do that mathematical modeling. So it told us how many additional vehicles we needed. It helped us build the schedule. And when we quantified it, we estimated that from project start to delivery, it saved us 40% of the time we would have spent doing this if we did it manually and we had data analysts doing the modeling and all of that. That would have taken weeks. It didn't take weeks. So that's one way that we used it. Another way that we used it was we identified through our IPC audits that we had an issue with inoculation injuries, mainly sharp injuries. And we decided to do a quality improvement program. And this quality improvement program was meant to improve behaviors and to reduce these sharps injuries. We used AI tools to, one, help us decide which locality was the best to pilot the quality improvement program. So we use data from all of our other audits. We use data from the amount of vehicles at different localities, the amount of staffing at different localities. And we used all of this, inputted this information, and it helped us decide, okay, this particular area would be the best one to pilot this program. Now, this program is still ongoing, so I can't tell you how successful it is yet, but just helping us to decide where to do this pilot. And then we had some soft intelligence as well. You know, we would know, okay, like the staff here would be on board, etc. So we were able to put these two together and decide on where to start this project, how to roll it out best. So that's how we've used it in that instance as well.
It's brilliant. Sounds very fascinating. And this is the AI that you have built in your trust. That's what you're using.
No, so this isn't the one we've built. This is
Okay.
These are tools that are already available. So these are
Right.
Your chat GPTs, these are tools that are already available that we used
Right,
to support these projects.
right, right. Um, I'm 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 interested to also know that so that other people on the call can also bear in mind that it's not just a you project. When it comes to your stakeholders, do you mind just talk briefly about people you had to work with because you are bringing your own clinical input into it? You were not the only one running everything. You had extra person. Just for people to know that, right? It's not a one-man show. So can you just talk through that?
Yes, it definitely isn't a one-man show. I have the ideas and I have the clinical knowledge and I have some understanding of how I believe X would work best. But actually with, for example, with building the model that we are doing in our I haven't got a clue about.
And that's okay, right? That's okay.
Absolutely okay. I don't know how to code. I don't have any experience in coding. I don't have any experience in understanding of the interfaces.
Mm,
That's where the rest of the stakeholders come in. You don't have to know how to physically do it. You have
mm-hmm,
to have the ideas, you have to have the bravery to put them forward, and you have to have the clinical knowledge of how they would work in practice. But
mm.
I don't know how to code. I don't know how to code at all. But I have understanding of how AI works, and I have understanding of how healthcare works. And I think that's really important, especially if you want to move into this space. You know, if you're like a nurse on the ward and you want to come into, you know, a transformational role, you know,
Mm,
you just need to identify the gap and have
mm-hmm,
some ideas on how to fix it. That's your starting point.
mm. I like what you said at the beginning. You said you used the word, you said, I was frustrated. And out of that frustration came the idea of, okay, let me look into IPC. And then you got into IPC and then you saw another need. And you said, you have the idea, you got the bravery, you have your clinical knowledge and understanding of AI. And then you mix all of that together to help you into what you're doing today. And I really hope that speaks to people on the call that it's about being brave. You have the idea, you know the gap. You are the best person to understand the gap because you are in that space. So have your idea, be brave with it. You have your clinical knowledge, nobody can take it away from you, and then go outside. I like what you said also about you said you said something about being stuck in the textbook. I think that's the way to go because you can never because as soon as one knowledge comes out, especially with AI, it's very rapid. You need to
Yeah.
keep up. And that honors to learn. It's on you. It's not on your trust. It's not your education department in your trust to teach you or train you. The responsibility is on you to learn and to keep learning and learning. So thank you very much. That speaks to me honestly. And thank you for sharing that.
Yeah, but I would say I know that being stuck in a textbook is not for everyone, but I have given in to the fact that I'm a lifelong learner, and you know, I jokingly say to my friends, you know, that I'm a perpetual student because you know, like you say, you know, knowledge continuously increases, and particularly in this digital space,
Hmm.
there is a newsletter, an AI newsletter that I subscribe to. It's TDLR. I don't know if you know that one. And
No.
and one article a few weeks ago, they were talking about how fast AI is moving. And they said every 6 months it has increased sevenfold. So this is
Mm.
how, so if you have no knowledge of it now, do you know how far behind you are? You are so far behind. And this is my worry for specialisms such as IPC that I am in, that I'm passionate about. We are so behind the curve. When, you know, the hammer does drop, it'll be such a catch-up game that people will be
Mm.
trying to play to get on board because
Mm.
like it or hate it, this
Mm.
is the way the world is going. We can't
Mm.
get away from it. We can't get away from artificial intelligence. it will be affecting our lives in one way or another, in every area of our lives in one way or another soon.
Mm. Yeah. And what you said initially, you said you were afraid of it initially,
Yeah.
and moving from what you were then to what you are now, it's very interesting that knowledge, yeah, and understanding can really change your perception and move you from a place of being afraid to a place of, right, I can do this. I can teach them how to do this, right? So
Yes.
I totally agree with you on that. That yeah, we have to. And what you said about not everybody is wired up to being in school, to be doing one uni course every other year. But I think what is important, the little that we can do, like courses on Coursera, newsletter, like you said, signing up for newsletter and reading those newsletters, that's a bit of education, isn't it?
It's a great bit of education. And what it does for you is when you're in the workplace, when you're in those meetings, you have good ideas. And how do you get the good ideas? You get the good ideas from the newsletter things. You get the good ideas from reading. So you have to seek out the knowledge to be
Mm,
able to have the good ideas in the meeting that will give you presence, that will
mm,
give you um notice, people would start to notice you. And, coming back to when I started doing that teaching in AI, that's how it started. It was from me going on about, oh, I used it to help me develop this program that I was doing for childhood immunization uptake. And I was using it for this, and it really helped me with that. Somebody noticed that and said,
mm,
hey, could you now take this new position of doing this for the organization? So career progression requires you to have knowledge. You have to seek it out. You can't just be, if you want to move ahead, you can't not read. You
mm,
can't not be aware of what's in the long-term plan, of what's going on and where
mm,
things are moving. You will get nowhere, because then you will end up you'll be in forums where you have no value to add.
mm, mm, mm. That's very important. I'm thinking of people on this call who are not IPC nurses, who are not
Mhm.
infection prevention control nurses, but who, for example, works on a dermatology ward or works on orthopedic ward, and they're sat there thinking, right, so what do I do with this knowledge? What do I do with what she's telling me? Yeah, can you speak into that, please?
I think the principles are the same. So nothing
Mm,
that I've said, is specific to IPC. The principles are exactly the same. And you know your area of work.
mm,
You know where things aren't working well. You find the gaps, find the
mm,
solutions.
mm,
Once you start by finding the gaps and being able to find the solutions, you also have to position yourself in a place of influence. And that's
mm,
what I did when I told you I started that public health course, because I know I wanted to have influence, but I didn't know where it would take me.
mm, mm.
So that degree that I started, even though I was in the middle of it, that helped me to get that job, to be able to have influence.
Mm,
You being the band 5 with no subsequent um training, no additional information, no additional certificates under your belt, would you be listened to in the same way that me coming in with my years of experience and my 3 certificates and my specialist interest in this area, we wouldn't have the same level of gravitas?
mm,
And
mm,
what I also say is really important, that is as you are developing yourself, you need to start applying for the jobs. Don't be the band 5 and the band 6 with the master's degree. It makes no sense. By the time you get the master's, you should be in some major leadership position.
mm, mm,
Yeah, so it works in tandem, but positioning yourself is really important. So once you start identifying those gaps and you have those solutions, you need to be in the meetings where they are heard. And how do you
mm,
get there? You don't get there by not doing any additional training or any additional development.
Hmm. Yeah, fantastic. I've really enjoyed this conversation. I want to open it up for other people on the call to ask questions. And I think I've got one in the chat. Um, and the question is how different it is from chat box. I think this is someone who's referring to LLMs like ChatGPT and Microsoft Copilot. I think the question is around that. How is it different from a chatbot? If your trust have to develop their own AI with possible data, I was wondering if Fru asked the question in the chat. I was wondering if she can unmute herself and ask
Okay.
directly if she's happy with that.
Yes. Yeah. Yeah. Thank you. Thank you for the presentation. So my question was regarding to the fact that she said that her trust is trying to develop their own AI and they're inputting data that is good that staffs are going to need. So
Mm-hmm.
in my trust, we have Copilot, we have Chatbox, and so I'm wondering, is it that you're going to have the two, or this your Copilot or the AI you're going to have, is it going to be different? Is it going to play the same role to Chatbox? Because that's why I think Chatbox is basically a bit like our Copilot. I don't know
Okay,
if it's making
I
sense.
think I understand what you're asking. So
Yeah,
there are hundreds of different AI tools.
yeah,
Copilot is one type, Chatbox is one type, ChatGPT is one type. ChatGPT and Copilot have quite a bit of similarities, but there are also AI tools that think about think about an activity, it could do it. So there are AI tools that could create videos. That's one of the things that we're also looking at, how we could create training videos using some of these AI tools. The
Interesting.
AI tool that we are developing is specific to infection prevention and control. The
Hmm.
data we are inputting is not sensitive data. It's
Okay.
policies, it's procedures,
Right.
it's how to manage certain situations.
Hmm.
So we are inputting that information, and once a member of staff needs support in that area, they're able to then pull that back out of the cloud, but
Right.
in a structured way to give them the direction that they need, if that makes
Hmm.
sense. So it's
Hmm.
a completely different tool, completely different. So when we talk about these LLMs, when I say think about an activity and one of them could do it, I don't say that slight. It is true. You know, there is another tool that I use in my day-to-day work for building presentations called Gamma.
Mm-hmm. Mm-hmm.
So instead of using PowerPoint, Gamma is incredible. Absolutely incredible. You tell it you want to do a presentation on XYZ. You want it in 10 slides. It gives it to you in 10 slides. It gives you pictures. It gives you all the graphics you want. And then you could then use that as your base to then modify it and add more information and fine tune it as you need. So I can't say enough how incredible artificial intelligence is and how it creates efficiencies once you know how to use it. So I hope that
Fantastic.
answers your question, Fred.
yes, yes. Thank you.
I think I hear what you're saying around that. Um, what I was thinking in my head is about the admin bits. That if you have a job to do that doesn't necessarily involving patient data or anything that identifying
Yeah,
anyone, like your admin work, your PowerPoint, there are tools out there to do everything
perfect.
for you. And right now, people were walking before. Now people are running like on like Usain Bolt kind of speed running. And you just have to catch up using that. However, there's an element around what you um around patient data. If what you're working on is about patient data, things that have to do with identifiables, then that's the bit where you need to be consulting, looking at your AI policy at work and say, what does the AI policy in my trust, what does it say about using this with any patient information? Because that's a big one, and you don't want to be caught in that. Um, I think there's a lot of conversation around AI governance
Yes.
generally in the UK. There's a big conversation about that. So whatever you're doing in your trust, just make sure you have something to cover that, because you don't want to be caught in that mix. Do you agree with me, Marisa?
Yes, I 100% agree. And the EU just passed some legislation on the use of AI in healthcare, which I'm not sure how soon it will trickle over to the UK since we've left the EU. But
Mm,
these are things we have to consider. But saying that, coming back to prompting, once you know how to prompt, you don't need to input any sensitive data that could put you at odds with your organizational policy. You absolutely don't need to, once you understand how to prompt and how to speak to the system properly.
time. I've got a question the beauty as asked in the chat, and she said, and it's a brilliant question. She said, are there any drawbacks with the use of these LLMs?
There are. It's not perfect in any way. And some people think that AI can replace certain careers. It can replace some careers. It can. Certainly, if you're in that data analyst space, I would be worried. But it can't replace us. And I give you an example, Beauty. If I, as an IPC specialist, ask AI to write me a report, and you who have no IPC specialism or knowledge ask AI to write the same report, would you be able to pick out from it what's right, what's wrong, what we should expand on, what makes sense? You wouldn't. So it still needs that human element to make sure that the outcome is correct. So don't think that these AI tools are perfect. Remember what we said at the beginning. They talk to you based on information that was fed to them, and people could feed rubbish to them. Another issue with AI is it has a tendency to be sycophantic. So what that means is, if you, again, come back to knowing how to prompt, if you ask AI a question like, AI, does sugar give you blue hair? It has a tendency to just agree with you. Sugar may not give you blue hair. So depending on the tool you use, depending on if the tool is a paid for version, that's also very important.
Yep. Yep.
It will just agree with you and then give you bogus evidence to back that up. So that's another issue with AI. So I think those are the two key ones. You having to know what you're asking, not relying on it to be perfect, because it is not. And having that in the back of your mind that it could just tell you what you want to hear. So those are the two main ones, Beauty.
Yeah. Thank you. I think that's very important to know that even as nurses, right, when we talk to our patients, when we talk to our family members, they will tell you, oh, I asked ChatGPT to tell me about this. I've got an itchy ear. So I asked ChatGPT what that means. And ChatGPT tells me that I've got cancer I've got cancer in my of the earlobe or something. I think it's our responsibility as nurses to educate them with what we have to say. Hang on, just like you said, it depends. What is it paid version? Do you know what you're asking, ChatGPT? Do you understand it? You can't ask a blank question, because what you give in is what you get out, right? So we need to educate ourselves, to educate our patients or family members that come to you to consult you. You know what it can be like. So we need to educate ourselves on what the advantage as well as a disadvantage of all of these gadgets, know the loops and the corners around it so that we can be rightly informed to educate people around us. And I think that's very brilliant about what you said. Yeah, ChatGPT can hallucinate and confidently give you wrong results. So you need to know what you're asking it. You need to
I
understand
like
it.
that.
Yeah,
I
yeah,
like that. It can hallucinate. It really
yeah,
can.
yeah,
It
yeah,
really can hallucinate. So it's really important, how to use it, how to ask a question and what to ask. Or else, you could just be fed a lot of crap.
yeah. Yeah, it's 3 minutes past 7 now. I think we have come to the end of the chat of our webinar this evening.